on right now, so let's move on to our next session then, which is about the Inter-American Coalition for Regulatory Convergence and their work with good regulatory practices. So I would like to invite Sandra Lydia Gonzalez, who is responsible for the coalition and has been doing a fantastic job with different efforts with the regulatory actors and stakeholders in the region. Sandra, the floor is yours. Thank you so much, Carlos. I would like to share my screen with you right now then. I'm not sure if you can already see my screen and my presentation. Could you confirm that you can see my presentation? Not yet. Okay, just 1 second, please.
Okay. Ahora sí la ven.
Do we have it? Can you see my presentation? Okay, perfect. Thank you. It's not in presentation mode yet, so let me just correct that. 1 second, please.
Okay. ¿Quedó correcto ahora?
Okay, all good. Okay, so perfect. Thank you so much. So thanks again for having me. Thanks for having the IACRC to be part of this event. So with all the efforts that we have done, we know that we have a lot of challenges to deal with, but we still are able to contribute so that in the short, medium, and long term, we can advance in a more sustainable way for the regulatory convergence and use some benefits that we have learned. Today, I'm going to talk a little bit about the coalition, the good regulatory practices, and the actions that the IACRC does. So I would like to share with you what the coalition is, which gathers the stakeholders in the regulatory convergence sector, including representatives from 10 different countries and 17 associations and chambers. We also work collaboratively with 6 other standard developing organizations. We want to have one standard accepted across the Western Hemisphere, and our mission is to contribute and collaborate so that the regulatory technology and standards can contribute to facilitate access to innovative medical devices. With that, the elements necessary for the convergence are good regulatory practices, and these practices are about the quality and consistency of the process that has to be conducted to update standards. With that, we need the coordination of all sectors involved, both in the government and also in private sector, so that all these standards are conducted in an open and transparent way with the participation of the stakeholders, and that the results consider the international standards based on science that has the best norms and regulations. The regulatory process has different stages in which each stakeholder has a main role, but each and every one has a different participation, and the participation of the actors has an importance to guarantee all the points of view and experiences and all data pieces are considered. For that, the World Trade Organization generated principles to develop and manage the regulatory technical standards. With that, we have to consider transparency, the use of science-based data, and focusing on the product that is being regulated. One of the important aspects is the impact and the evaluation of the regulatory impact to guarantee that all variables are being considered whenever this assessment is conducted. This process has to consider all the resources available to identify what is the best alternative regarding the sustainability within the government processes to develop and implement those standards. We must pay attention to limit the action of different stakeholders. This has become very clear during the pandemic, where we see a huge dependency on global aspects. So it's important to guarantee that regulations consider within their construction the international barriers. When we evaluate a regulation within all that cycle until the implementation and the assessment of the regulation, to guarantee that the proposed offer complied with the objectives that was designed to. We can also make the different changes that are needed. In order to do that effectively, we also recommend the implementation, the existence of a coordination body within each government. So the idea here, going back to the regulatory impact assessment, we have to evaluate the impact of the regulations on the market. And the idea is to really quantify the benefits, the costs associated to that, in order to consider tangible, but both also intangible variables whenever formulating norms and standards. These regulations may have a very positive impact or also a negative impact regarding international trade. That's why the impossibility of different patients have access to medical devices. The World Trade Organization, together with other actors, promoted a project to incorporate transparency and points of view of the international community, and that generated different mechanisms to identify the regulatory proposals that are, and all countries, signatory countries, have to comply with the processes, and it's a co-responsible project from governments and the private sector to feed the tool that is made available by the committee to diminish the barriers. This is a tool called ePing, and it's available to all people interested. Well, regarding the good regulatory practices, it's clear that good regulatory practices are a fundamental tool so that we have effective tools and standards that are not restricted to the trade. And with that, we have to guarantee that both industries and regulatory agencies are on the same page and have the same knowledge and understanding of what that means. So we have to develop skills and also implement procedures in order to guarantee the correct implementation and compliance of all these international obligations that are related to the World Trade Organization, and also to develop for the economic development of all countries that are part of it, and also countries that are part of the region and their obligations with their commerce and trade processes that are already incorporating good regulatory practices in their statutes. So with that, we will be able to have a good regulation based on international standards, based on transparent processes, and that will have a definitely positive impact on the regulation of medical devices. This is a process that requires interaction of different stakeholders. The WHO, its guidelines and frameworks published that are fundamental to the countries. And they started in the month of April with their guidelines of good regulatory practices that brings this conversation closer to health regulatory bodies that were not so close to that, because most of that talk was done by commercial actors. So now we have that conversation closer to the health regulators, and we will be able to advance faster. Obviously, with the legal standards promoted by the global medtech industry and all other regulatory bodies, and the participation of government representatives and the private sector and international partnership like the American Technology Alliance. With all of that, we're able to collaborate so that all stakeholders are aligned with their proposals to advance towards regulatory convergence and implementation of good regulatory practices, together with the World Trade Organization and USAID. So with that, we are able to build those capacities between different stakeholders. So we try to promote all these capabilities through making resources available and developing tools that are available on the IACRC website. We also have to develop different materials and positioning to bring that to different countries and start conversation with different countries and develop new sessions of training that are both general and specific per country, so that all stakeholders know what to do in order to implement good regulatory practices on their day-to-day practice. One of the important things is the access of information both in Portuguese and Spanish, because we know that nowadays language is a barrier to advance in these issues. We know the efforts of different institutions to make materials available in other languages. We are also aware of the time that it takes, and that's why the IACRC has translated several documents that we consider very important. In this slide, you can see and access our website, and
Among its contents, we have information regarding the international standardization, good regulatory practices, and transparency in trade. On our website, you also find all the materials and tools, all the training programs we have produced, so all stakeholders can benefit. We have trainings on good regulatory practices and other trainings focusing specifically on Brazil, Colombia, Chile, Mexico, and Peru. We have host sessions with different regulatory agencies, and we have planned a number of webinars on MDSAP, ISO 13485, with the participation of the FDA and VISA and ANIMAT. So all the countries that are working to update their models can have visibility and knowledge how other parts of the world are working. And we also have the documents with our official statements. Regarding training, on the slide, you have the direct links to each of the training sessions that are available on our website. And this is available in the coalition website. Regarding good regulatory practices per country, here you'll find the links to all the training sessions that we have had. And you can access these trainings in Spanish and in English. Now, these are the links for all the sessions we have had with different regulatory agencies. And I would like to invite you to a session that will happen tomorrow. It will be the first of a series of sessions we will have with FDA and other stakeholders to discuss the use of international standards and the assessment of conformity that will be focusing on different stakeholders in Latin America. Regarding different documents that we have available, they are all translated to Portuguese and Spanish, and you can find them on the links on these slides. They were produced by the World Health Organization and 3 others that are available in Portuguese, also from WHO. Regarding our official statements, we have one about the law of pharmaceutical products, number 2 from Chile, that will allow us to regulate medical devices in Chile, because as you know, this regulation is quite limited right now, and it encompasses several products. In Ecuador, we have the regulation on traceability. We have identified that there is a very close relation between the recommendation and international standards, and very specific limitations regarding the identification systems with optical readers that can be complicated. And this has also has to do with how these regulations are operated and with a broader or less broad implementation of the standards. With that, I conclude my presentation. I'm open for questions, and if I'm always available to help you in your efforts. Excellent. This has been an excellent presentation, Sandra. Thank you. And I have some questions. Not to say how many countries are already participating and the recent accomplishments you all have had. If you could please talk about that. Yes, thank you very much, Carlos. Currently, we have 10 countries that are members of our coalition. Of course, we want to include all Latin American countries, but one of the important challenges we face is the lack of associations, especially in Central America. As we know, most of the distribution processes are done through distributors. So it becomes a more complex interaction. But we hope that the scenario evolves and they can also have their representative institution. And besides that, we have some other specific challenges. I say that in terms of advancements and accomplishments, or maybe the most recent and important accomplishment we have had, is that last week on December 1st, we got the approval. I'm sorry, actually, by December 1st, the Global Harmonization Working Party accepted our proposal to turn them into an institution that would be connected to us. And in the same ceremony, FDA became part of the same working part. And we are very happy to see that happening, because only by working in a collaborative fashion, we can find the knowledge that will allow us to use all the resources more effectively, working for the same common goal. I would say that these are some of the most important successes we have had. A project that is part of the coalition is the Regulatory Convergence Project for medical devices for COVID-19, as was mentioned in the beginning of the event. And the coalition is a member that is executing this strategy, and we have made important investments in some countries in Latin America, talking specifically now about Colombia and Mexico. And we are supporting the development processes of new standards and the development of good regulatory practices. So they are developed considering quality assurance elements that define the way the regulatory process is used in order to comply with all these standards. So in the end, benefits are more efficient, because working together with different levels of government. For example, in Colombia, the National Department of Development, the Ministry of Health. For Mexico, working with COFEPRIS, with CONAMER. And all this joint work allows us to collaborate together, to collaborate with different government institutions, because by facilitating communication and access to resources, we have a positive impact in the development of new standards or in the update of the current standards. Now we stop talking exclusively about regulation and start thinking about the advantages that this can have for trade and the economic order. So in this sense, for regulation, today we have the use of tools that are well known by all of us. Reliance was one of these tools used during the pandemic, and so many others. But something that wasn't mentioned before was the use of standards for regulatory purposes. And inside the coalition, we have a very nice project, a project that was taken to 3 countries together with Aladiv, and now on the second stage will include 4 more countries to identify which norms or standards have already been incorporated by the countries and by some reason are not being properly followed, but they could be. Reducing time to access new products, and of course to improve the health scenario in that country. The World Trade Organization is a great partner we have in conducting this work, right? Sandra, thank you very much for your participation. It has been excellent. Would you like to say any final remarks? Yes, and talking specifically about what you just said, this collaborative effort in the international scenario, we are certain that we are starting to see all the positive spin-offs. We work collaboratively with WHO, with the Pan American Organization of Health, with the World Bank, with the American Business Dialogue. So we can count on their resources and the knowledge from the essential stakeholders so we can develop our abilities in the region. And one important aspect that maybe the pandemic helped us realize, and with initiatives of WHO and the good practices guidelines that were published, is how we can use international standards. And it's an essential work, because many times we see that they are used as a foundation, but eventually they need some type of adaptation according to the country's specificities. And in the end, that limits the possibility of access, and it adds cost to this process in the country, making it impossible sometimes. So this collaborative work with all these different entities definitely will help us with a higher participation of different regulatory agencies and private stakeholders to the development of these standards. So we can contribute for the update of these standards and the possibility of incorporating them into different regulatory systems. So once again, thank you for the invitation, and I'm available if you have any questions or if you need me somehow. Excellent. Thank you, Sandra. It has been a pleasure to have you with us. By request, the link to the coalition website is on the chat. I invite you all to get to know it. It's a fantastic work that is developed by a brilliant team, and they have been able to make great advancements. The work on regulatory convergence is only possible with the participation of everyone.